The presentation that you are about to see was recorded live at the American Natural Hygiene Society's 45th Annual International Natural Living Conference held at Georgetown University, Washington, D.C. The speaker for this presentation is Dr. Alec Burton. Dr. Burton is the founder and president of the Australian Natural Hygiene Society. He is a founder of the International Association of Hygienic Physicians and has served as its president. Dr. Burton is one of the most respected authorities on natural hygiene in the world today. Dr. Burton's presentation is entitled Common Ailments, the Natural Hygiene Perspective.
Well, thank you for that warm and enthusiastic welcome. I'm quite anxious to hear what I've got to say. You know, sometimes you get a bit concerned because the introducer virtually gives you talk for you. You've got to watch that on occasions. That's why you've got to be very subtle with the title. Don't give them too much information in the title. Otherwise, you know, I can remember the time when Dr. Bass here was giving a talk on sex. And he only had 30 minutes, and the person who was introducing him took 29 and a half minutes to introduce him with all his qualifications and his credentials and everything else. Finally, Dr. Bass gets up and he says, "Good evening, ladies and gentlemen. It gives me great pleasure." And he sits down again. That was the end of his talk on sex. Now, we're going to try and clarify a few things about the hygienic system. I'm going to talk about a few different so-called diseases. But first of all, it's important that we go back a little way. We'll go back to over 150 years ago to the time of one Dr. Isaac Jennings. Now, it's generally agreed that Dr. Jennings was the, shall we say, the modern developer of the hygienic system. And he referred to the system as orthopathy, or orthopathy, whichever way you want to look at it, which is derived from two Greek roots, orthos, like orthodox, meaning straight, correct, upright, and pathos, meaning affection, disease, suffering, and so on. And he meant to imply by his term orthopathy that disease meant right suffering, or that disease was correct for the circumstances, which is essentially the hygienic viewpoint, that disease is a survival mechanism, a very important survival mechanism. Now, you can appreciate that if a person inadvertently or deliberately consumes a virulent poison, they will probably vomit. And one can appreciate there may be other symptoms as well: severe epigastric pain, fever, sweating, diarrhea, and the body is unmistakably attempting to defend itself against that poison. We have here a vigorous defensive process. Now, you can appreciate that all of those symptoms are life-saving. Those symptoms are a part of the survival mechanism. And now, if we attempt to cure that disease, in quotes, if we attempt to cure those symptoms, we're obviously going to be seriously frustrating the body's attempt at defense. So therefore, we obviously wouldn't attempt to cure these things. In fact, you will find that if people do swallow any virulent poisons and they go to the emergency room, they'll probably be given another poison which will encourage them to vomit, because they recognize the need to get that poison out of the body. Well, Dr. Jennings coined this term orthopathy to indicate that disease as such is a remedial process, a defensive process, an adaptive process, a reparative process, that it is a survival mechanism. Now, many, many years ago, Dr. Samuel Hahnemann, about 200 years ago, said that there is no such thing as an incurable disease but there are plenty of incurable patients. And this is the crux of the thing in hygiene. When we're confronted with a sick person, it's not whether the so-called symptom complex that they have, the so-called disease, not whether they can recover from that, it's whether this patient themselves can recover. The point is that you can have 20 or 30 people suffering from, say, arthritis or asthma or gastric ulcer or colitis or any so-called disease. And here you have 20 thinking, acting, feeling individuals who are all different. Now, obviously, if they're all different, they have needs and capacities which are quite individual. Why would we attempt to try to design a form of treatment for the arthritis or for the ulcer or for the colitis or whatever? Because these are different people. Some are going to respond one way and some are going to respond another. So this is the crucial point that really distinguishes hygiene from all of the therapeutic systems. You notice the therapeutic systems are repeatedly talking about a treatment for a particular disease. Now, in the Chicago magazine last month, this month actually, the July issue, the front cover is entitled Racing for a Cure. And it's talking about a cure for cancer. Now, they've been racing for this cure for a very, very long time. And, it's a race at a snail's pace. Now, as we know, cancer manifests itself in many, many different forms. And it's a very, very serious pathology. Nobody has the answer. And I don't want to appear as though we as hygienists are dogmatic in our attitudes that we have the answer to all health problems and so on. This is not so. We don't have the answers to everybody's problems. We don't have the answer to every problem of health and disease. What we would argue, perhaps, is that we are in possession of certain fundamental principles that will help us lead us towards discovering the answer. Now, fortunately, when it comes to the discussion of cancer, the research does tend to concentrate on mechanisms. But the unfortunate part about it is that 90% of the billions of dollars that are expended on cancer research are expended for the development of drugs with which to treat cancer. Now, the hygienist does have a problem with this, because what we have to try to do, we should be spending this money on understanding the physiological and pathological mechanisms that underlie the problem. Now, at the present moment, Dr. Nejla and myself in our practice, in many instances, we will work alongside with medical specialists, oncologists, surgeons, radiologists, and various other people in trying to solve patients' problems where there is something like cancer, which does not necessarily respond to hygienic care. Usually it doesn't. In fact, Dr. Shelton said that generally the hygienist regards cancer as an irreversible pathology. Now, we can all point to situations of people suffering with cancer who have recovered. And that's why I emphasize this point about the patient rather than the disease. From the hygienist point of view, we must design the program of care according to the patient's needs and within the patient's capacity, not according to the diagnosis. Now, most of hygienic care results from manipulating the environment and then leaving things alone. What Dr. Jennings referred to as doing nothing intelligently. The intelligent leaving alone program. It's a little bit like the gentleman who went to the doctor very, very sick, complained to the doctor. The doctor said, look, I'm going to refer you to a psychiatrist. He's a brilliant man. He'll be able to solve your problems for you, but he's very expensive, quite unique, but very expensive, but I know you can afford it, so go and see him. So he goes along to the psychiatrist. The psychiatrist says, yes, well, it's half an hour sessions, you'll need 10 sessions, and it'll be $500 a session. So anyway, he pays his $500, has the first session. Psychiatrist says, right, you lie down on the couch. If you feel like speaking, you just speak. Talk about what you want. If you don't feel like speaking, that doesn't matter either, just lie there. So he just lies down on the couch, finishes his session, pays his $500, and off he goes. This is repeated for the 10 treatments. Never says a word, just lies on the couch. After the 10 treatments, he's just leaving, and the doctor turns to him and says, haven't you got anything to say? He said, yes, do you need a partner? Now that's an extreme situation of what I'm talking about with the intelligent leaving alone. Now, many years ago, one of my teachers pointed out that this treatment business is all very well. And if treatments would get the patient well, we'd have 3 shifts a day working on them. But we know that that doesn't effect a recovery. Now, if you study your magazines and your journals and your newspapers month after month, and you collect these over many, many years, and you can look back over 10, 15, 20, 30 years, you'll find that you've got a collection of all sorts of cures for this disease, that disease, and all sorts of diseases, even cures for diseases that haven't been discovered yet. And the cures come and the cures go, but the curing goes on forever, as Dr. Shelton used to say. Now, this business of looking for a cure. Now, the Hygiene Convention is not the place to look for a cure. If you're looking for a cure, you go elsewhere. Because we're really not interested in cures, because they do have one rather significant weakness. They don't work. And from the hygienic point of view, the recovery of health requires the removal of the causes of the ill health. Now, whether this be a simple pathology like a boil on the back, or an extreme pathology such as cancer. Now, in a situation like cancer, we've had some remarkable successes with people, and at the same time, we have also seen people who don't respond. Now, very careful monitoring of these people is obviously very important, so that if you see that things are not going the way they should be going, you can at least resort to other methods. Now, when I criticize therapy, I am not saying that therapy is never of any value. After all, surgery is a therapy. And certainly in some instances, surgery is absolutely life-saving. So there are occasions when surgery can be of benefit. But we must at the same time understand that surgery may remove the pathology, but it does not remove the cause of the pathology. So here is where we might see very good cooperation between the conventional surgeon and the hygienist. Because the hygienist is out to try and remove the causes, he will affect a change in the individual's lifestyle, and the surgeon may remove surgically the offending pathology. That way we'll often get a good result. As my wife always points out, it is never wrong to do the right thing. And there's a lot of wisdom in that. Even if you're going under surgery, even if you're going to be subjected to radiation, even if you're going to take drugs, whatever your decision is in a situation, you still should be looking after your lifestyle, which is generally taking care of your health. There is a distinction between treating disease and looking after your health. Hygiene is concerned with looking after your health, not with treating disease. Now, we talk about what we call the unity of disease. Now, conventionally, a person may have sinusitis, laryngitis, gastritis, hepatitis, nephritis, all at the same time. It's quite probable that it's quite possible that these could occur at the same time. Now, does this person have 5 or 6 different diseases, or do they have one disease? From our point of view, the person is sick. Now, we realize we can identify different structures that are inflamed and are causing problems, and we might say, well, these are different diseases. Now, conventionally, of course, the person is going to be getting 5 or 6 different treatments. And none of them have anything to do with the causes of the problem. So the hygienist is going to say, right, well, the problem arises because the causes are not being addressed. The causes have never been removed. And there are positive causes for every one of these pathologies. And probably in almost every instance, the cause is the same. It's like the man who went to the doctor with his hands shaking. The doctor said to him, "Do you drink much?" He said, "No, I spill most of it." We see disease as an evolution, right from the very first cold or gastric upset in infancy, through the various childhood diseases which may impair the immune system, which increase the toxemia, disturb the body's chemistry, right through to the evolution of chronic degenerative diseases in maturity. We see here that there is a sequence of events. And these things are always important, because what has usually happened is that at each stage of the evolution of the process, suppression has taken place. The person has been taking drugs, the person had all sorts of treatment, maybe they've had surgery, they may have had appendicitis, the appendix has been removed, appendectomy has been performed, and once again the causes have not been removed. The person goes along a little while longer and has gallstones, or the gallbladder is removed. Once again, the causes are not removed. Later on, he develops renal stones, renal calculi form in the kidneys, and of course surgery is performed to either remove a kidney or remove the stones. All along the line, the causes are never removed, they're never addressed. So in hygiene then, we're concerned about these things, we're concerned about these causes. We can certainly take drugs to palliate the symptoms, will make the patient more comfortable. And one of the difficulties with medical education is this problem of in hospitals, when one goes into the wards and you're traipsing around with the professor, looking at all the patients and questioning the patients. They're lying in the bed there, pretty defenseless. You look at the charts and you ask them how they're feeling. This is of limited value, because here we have a very sick person, and we're not seeing what we might refer to as the natural history of disease. The symptoms and complexes this person is reflecting represents not only the disease process as it manifests, but also the results of the treatments, the drugs, and the therapy that they've been receiving before and whilst they've been in hospital. So we don't see a clear picture of the patient's symptomatology. This often makes it difficult to make decisions of how to proceed. And of course the usual procedure is to give some medication that's going to palliate the symptoms, and of course the person is reasonably comfortable. But the causal mechanisms that have not been addressed are still operating within the body. While cause persists, the disease processes will persist. You may not experience them, you may not be aware of them. But what will happen farther down the line, they evolve in some serious problem, such as diabetes, arthritis, cancer, or whatever, with relative undramatic approach. In other words, they appear quite silently, and all of a sudden you realize you're in a desperate situation, because at no stage has this problem, of course, been addressed. Now, to the hygienist, this is a sad situation. Now, in recent years, medicine has been addressing causes when it comes to a few things like cardiovascular disease. They're well aware of the importance of dietary factors in the evolution of coronary heart disease. And having outlined that mechanism, they do give some lip service to dietary change. But as we know, it's only relative lip service. Dean Ornish brought out the point that when he followed with his patients the advice of the American Heart Association, over a 12-month period, all the patients deteriorated because the advice is not sufficiently radical. A minor reform is not good enough. We need a radical change in the lifestyle. That's the only way we're going to accomplish a satisfactory result. Now, as I indicated earlier, disease is essentially a personal thing. It's peculiar to the individual. A person will often ask me a question: have you had a case like mine before? And I can say quite honestly, yes, I've seen hundreds. Or I can say quite honestly, no, I have never seen anybody quite like you. Because it is such a personal thing. The causes are individual. The causes are peculiar to this particular patient. If we're talking about the pathological process, we've probably seen hundreds of these expressions. Now, common ailments that we look at around us today, things like asthma, arthritis, colitis, you'll find that they fall into certain categories. They're essentially chronic diseases. They're essentially degenerative diseases. These are the problems. We no longer have problems with typhoid, cholera, poliomyelitis, smallpox, various acute diseases of past ages. They've more or less disappeared. Better sanitation, better hygiene, different nutrition, different environmental factors have done a lot to improve the situation as far as many of these acute epidemic diseases are concerned. But now we have a bigger problem because we've exchanged a lot of these acute febrile conditions for much more serious conditions where there is terrible degeneration occurring. And degeneration is irreversible. It's very important to appreciate that. Degeneration is irreversible. Now, when we say it's irreversible, we don't mean to say that we can't get some reversal, we can't get some improvement, but we're not going to get a fairly good restoration of normality. That's why it's so important to learn as much as you can about the hygienic system and apply it so that these things do not evolve in your life. Because one of the terrible things about degenerative disease is that it is often insidious in its onset. And when the person is in such state that they've carried out certain tests and examinations because they're not feeling as good as they should be feeling, they find they have a diagnosis of something quite serious. I suppose that a lot of people that we would encounter in our practice would be suffering from the rheumatic diseases. That's arthritis, systemic lupus, polyarthritis, various things of this type. We would see a lot of people in this particular category. Now, it's well known, of course, that the etiology of rheumatic disease is unknown. as is the etiology of many diseases, if we're looking for a specific cause. Now, one of the things that is very important is to recognize that all disease, no matter how simple, is multi-causal. It is not usually the result of one cause. And we see as a result of those causes the fact that disease is a process and not an event. And it's very important to understand this. Disease is a process, not an event. Now, I agree that a so-called heart attack is an event. A person collapses with a so-called stroke. It's an event. But it's an event in a long chain of pathological changes which are associated with a process. So what we should try to do, of course, is understand this process. Now, when we encounter people, say, suffering from arthritis, we are not really too concerned about what label we're going to attach to this arthritis. There are broadly two forms of arthritis, rheumatoid arthritis and osteoarthritis. But there are many subsections of that. Some will have positive antibody titers, others will be negative in this respect. But things like rheumatoid arthritis are said to be autoimmune diseases. That means that those parts of the body which are affected are being attacked by the body's defense mechanism because they have been falsely labeled. In other words, we have an immune system which is capable, in its intact and functional state, to know the difference between the self and things which are not the self, so that it only deals with those things that are not the self, foreign invaders, bacteria, degenerative cells, etc. But in arthritis, of course, this ability of the immune system to recognize and distinguish between itself and not itself has been impaired. And one's own immune system starts to work on one's own tissues. This is a very, very serious situation because it's virtually self-destruction. Now, this failure of the immune system is a widespread problem in today's society. Systemic lupus erythematosus, that's another associated disease along with arthritis that is probably more serious in that it's more widespread, affecting the liver, the kidneys, the lungs, and other organs of the body. And once again, it's a so-called autoimmune disease. Now, when we refer to these autoimmune diseases, we're talking about this dysfunction of the immune system where it is attacking one's own tissues. But this abnormality is one that certainly the body can put right, but it does require fairly dedicated and extreme care. Now, the unfortunate thing is that any change that we make in our lifestyle that's positive and beneficial is a good thing. But to get a complete turnaround in a person who's suffering from a very severe chronic degenerative disease, we have to have a very, very radical change in the person's lifestyle. In fact, one of the things that we've frequently observed is that if a person has a relatively good lifestyle in the first place, their prognosis is not nearly as favorable as the person who has a very poor lifestyle. The person who has a poor lifestyle, you've got much more room to maneuver. You've got many more things to change. But in the case of a person whose lifestyle has already been pretty reasonable, one has to be much more radical. Now, I spoke this morning at some length on the subject of fasting, because this is a technique used extremely widely in hygienic practice. particularly in the recovery of health. And as I said earlier, this is not a cure or a cure at all. It is merely providing the body with a condition of rest, extreme rest. Now, most of us do not get sufficient rest. In fact, on questioning patients, I usually find that they're suffering largely from enervation, from inadequate rest, aside from all the results of stimulation and so on. But one of my basic approaches in these situations is to immediately argue in favor of more rest. And I might say to the patient, well, all I want you to do for this next week is to get to bed an hour or so earlier. Promise me you'll get at least one more hour every night of rest. Doesn't matter if you go to bed and you don't sleep, just rest. You can't force the body to sleep. Even if you take so-called sleeping pills, there's a distinction between sleep and narcosis. Sleep is restorative. You recover from sleep. Narcosis, under the influence of sleeping pills, merely puts you in that somnambulant state, but it is not sleep, because it is not restorative. The body is just battling the drug. So you're much better off to just lie awake and think about pleasant things. Because that's a very hard thing for people to do. When they're in that situation, they usually think about unpleasant things for some reason or another. I say, well, it's your mind. You're in control, or you should be. Now, as you can appreciate, that a person walks into my office knowing virtually nothing about what I'm doing. They just come along to see Dr. Burton, being recommended, and here we are. Well, I learned a long time ago that one has to be very, very careful in the use of the shoehorn when you ease people into it. One of my teachers said that when he first moved to London many, many years ago, about the year 1912, nobody had heard of these ideas. And of course the patient would walk in and immediately he'd go through the whole range and talk to them about the change of lifestyle. And it was so radical, of course, the person would walk out and he'd never see them again. He realized he'd got his electricity to pay, his secretary to pay, his rent to pay, and all of these expenses. This wasn't going to work at all. So we quickly learned these things. So what he decided, that he was going to do it the piecemeal fashion, which with people in this category, it's often the best way to go. The person walks into the office, and you do an analysis of everything, but to select an example, the person is having cereals and milk at breakfast, and then ham and eggs, and then coffee and toast and jam and so on. Okay, we'll say, well, for this next week, I'd like you to drop the ham. We take the ham out of the breakfast meal and get them to go out for a bit of a walk or something like that. It depends. But we make a few changes. Very minor. Nothing terribly dramatic. Nothing frightening as far as the person is concerned. And they come back in a week's time. We do a little bit more. Gradually talk to them and educate them. In 3 months' time, we've got them on a very good program. They're getting better, and we're paying the rent. But of course it is quite a shock to the system, isn't it? All of a sudden you're told you must not do this, you mustn't do that, you ought not to do this, you ought not to do that. Before long you're suffering from hardening of the arteries. I'll just wait a second while that spreads to this side. But it's very important to appreciate that hygiene is not a system of self-denial. It's a question of being reasonable, a question of understanding. As I indicated earlier, there's no such thing as a hygienic program in the sense that there's something that's a blueprint program that you can give to everybody. It has to be worked out according to the individual's needs and capacities. That's why there's a lot of difficulties when one writes books, because you're giving a lot of general advice. And there are those people who will read the book and follow the advice and then come screaming back and say, I did that, and certainly look at the mess it's made of me. Fortunately, that's a very, very rare occurrence as far as the hygienic system is concerned, because there are so many checks and balances involved. Now, another disease that is very, very common in our practice is what is called chronic fatigue syndrome, myalgic encephalomyelitis, or post-viral syndrome. Various names which are a description of a bizarre group of symptoms that are very common in our society. Very common. In one form or another, I'm sure there are people here this evening who have a manifestation of this particular problem. A person is lacking in energy. That's usually the prime problem. They don't have enough energy. They're always tired. And this, of course, is one of the things that's associated almost invariably with any chronic degenerative disease. Exhaustion. Because exhaustion is part of the process of the causes. Debilitation. Complete and thorough exhaustion. Now, in chronic fatigue syndrome, of course, the exhaustion is so extreme that sometimes people cannot get off the bed for days. They just don't have the muscular strength to do it. They can't muster the energy to get about and do things. And aside from this, there are a lot of other disturbances, gastrointestinal problems, obscure infections, and respiratory difficulties, upper respiratory tract infections, and so on. Well, these people, of course, respond very, very favorably to hygienic care. We try and elicit what the probable causes are. In their own case, this may be associated with environmental toxins, exogenous toxins that are absorbed into the body. Now, many of us are exposed to a wide range of toxins. And these are real problems too, because there are about 350 to 400 environmental toxins clearly recognized as being carcinogenic. This is very serious. Now, these toxins, some of them are associated, say, with heavy metals and with organic phosphates and with hydrocarbons and various other toxins used in agriculture, in industry, and so on. And often these gain entrance into the body and they're excreted with a great deal of difficulty. They're often stored in the fat of the body. And sometimes when people are fasting and they're breaking down fat, these are released from the tissues and they will be eliminated from the body. It's important to realize, of course, that the person is not going to suffer acute poisoning because these things are released from the fatty tissues. That will not happen. It won't happen because, first of all, only a small amount of fat is broken down at one time, and this, as these toxins are released, they're usually fairly readily eliminated in the process of the fast. These are often the people who get some sort of liver action during a fast and may be producing lots of abnormal bile, which is discharged into the duodenum. As it is discharged into the duodenum is a fairly small cavity, and some may regurgitate back into the stomach. As soon as this happens, then the person usually vomits. And we do find that people say that they can taste things that toxins that they've been exposed to in the past, that they have an odor about them of various chemicals that they have been exposed to previously. This often happens during the remedial process. And one of the things that's very, very common when people are under hygienic care, in common ailments or otherwise, is what we refer to as retracing. That's when often they will go back over pathology that they've had previously. Quite recently, just the week before we left Australia, we had a lady who was under care for a particular problem, and during the fast and during her hygienic care, she developed enormous sensitivity in the jaw. It became swollen and quite distressing. But she'd had a lot of orthodontal work that was done earlier, and the jaw had been manipulated with various contraptions, and as a result of that, of course, there'd been scar tissue formed, and this was active during the fast. Another experience that I had many years ago, which was quite frightening, both for the patient and the doctor, I can assure you. This patient had been involved in a very, very serious automobile accident and had tremendous damage to the craniofacial bones and had considerable craniofacial reconstruction done. And during the fast, the face swelled up, it became distorted and became inflamed, the nose enlarged. The woman, poor lady, was quite disfigured. And anyway, certainly towards the conclusion of the fast, of course, this had all settled down and restored to normal again. But this is a sort of thing that you'll get. You'll often find that people will say, goodness me, I got a terrible pain in this left hip. There's something like I had about 5 or 10 years ago. Or I'm getting, quite recently we had a gentleman who experienced significant epigastric pain, which he had from an ulcer some 20 years ago, which was so-called cured by the Tagamet that he took at that particular time. So retracing is a phenomenon that's very common in hygienic practice. But all of the various common ailments are extremely amenable to hygienic care. But I would like again to say that we're not militant extremists. Doctors of hygiene are very, very responsible people, and there's often cooperation with other people in trying to solve the patient's problems. If we feel that we're not making the progress that we should, if we don't understand exactly what's going on, if we're performing tests and examinations that are not revealing the problem, then we will secure additional consultation. So that is very important. But the important thing with hygiene is persistence. The processes of healing are slow. You just cut your finger, a very simple pathology. It takes several days to a week or two to heal. It doesn't heal overnight. We're so mesmerized by so-called wonder drugs that we expect to be restored to health almost overnight. That doesn't happen. With hygienic care, the person is slowly piloted back to health. And often this recovery is interspersed with remissions and exacerbations. And this retracing that I've spoken to, which is sometimes referred to as crises or healing crises. During the process of getting well, the person might experience these difficulties. But the important thing is to stay with it. No matter whether you decide to have other care, whether you decide to have any other form of treatment for the disease or whatever, whether it's hygienic in its basis or otherwise, you stay with the hygienic program. Because, as I said, as Dr. Nesler always points out, it's never wrong to do the right thing. The body is always working in your best interests. And to keep it doing so, it's necessary that you provide it with its needs and you stay within your capacity. Thank you.
The American Natural Hygiene Society teaches people how to maximize their health potential by living in harmony with nature. The society, which is dedicated to health education, is the oldest national vegetarian organization in the United States. Its motto, "Healthcare is Self-Care," is a reminder that health is the result of healthful living. For more information about the American Natural Hygiene Society, its award-winning publication Health Science Magazine, and for a complete list of all the Society's books and tapes, call 813-855-6607 or write American Natural Hygiene Society, P.O. Box 30630, Tampa, Florida 33630. This recording was made possible by a grant from the James Hervey Johnson Charitable Educational Trust and the support of the members of the American Natural Hygiene Society.